Good day to you. Can you tell something about yourself?
I am Ruth Angeles Reyes Barbado, 27 years old and a graduate of Bachelor of Science in Nursing. Um, I am the eldest daughter and I have one brother. I have one child, a daughter, and my partner and I are not yet married. I work as a domestic helper in Kuwait for 2 years and 1 month. So I finished my contract. And there are 4 members of the family. And my main duty is to take good care of their elderly, their mother, because she's 67 years old, a senior, and she has the difficulty in walking. So every day I assist her walking through wheelchair, and every day I monitored her vital signs, especially the blood pressure. Also, I do the household chores like cleaning. Sometimes I cook also for the elder, for my client. And I focus for her activities of daily living because she is overweight and difficulty in moving. So I assisted her in bathing, personal hygiene, grooming, and the like.
Okay, your name is?
My name is Ruth Ann Barbado, but you can call me Ann.
Okay, your name is Ruth Ann.
Ruth Ann, yes.
Okay. So why you want to work in Hong Kong right now?
I want to work in Hong Kong because of my child. I want to give her a good future.
How old is your child?
She's still baby. She's still 3 months old.
3 months old. When you give
Yes.
birth, what kind of delivery?
I give birth normal delivery.
Normal delivery.
Yes.
Okay. So you as a single parent.
Yes, I am a single
Okay.
parent.
So your family allow you to work
Yes, my
abroad
family.
again.
Yes, ma'am. My family supported me to work again in abroad.
Okay. And at the same time, you had been before in Kuwait as a private caregiver.
Yes, ma'am. I've been there for 2 years as a caregiver and private duty nurse.
Okay. Private duty nurse and a caregiver. So meaning to say, you live with your employer or?
I live with my employer, ma'am.
Okay. So you also doing all the household chores.
Yes, ma'am.
How many domestic helper?
In that house, I live there with 3 maids, including me.
Okay. So 2 domestic helper and 1 private duty nurse.
Yes, ma'am.
So that is you is the one who is the private duty nurse.
Yes, ma'am.
Okay. And you finished your contract for 2 years.
Yes, ma'am.
Why did it come back again with them?
Because the salary is not enough. Because before I am single, now I have a baby to feed. That's why I need more
Okay.
to have a better future for me.
Okay. Why you choose Hong Kong?
Because I know Hong Kong will give me a better future and to support my family.
Okay. So if your prospective employer in Hong Kong is listening you or watching you right now, what will you promise to them so that they will hire you?
Ma'am, sir, if you're giving me a chance to work with your family, I promise to do all my duties and responsibilities as your household worker or your helper.
Okay. If your employer in Hong Kong has a family background which is the same to your employer there in Kuwait,
Yeah.
can you accept the job offer?
I will very much accept the offer, ma'am.
Or even though the family is healthy without
Yes.
a disability or some sickness, it's okay with you to accept the job offer.
Yes, ma'am, I will accept the job offer.
If your employer is pregnant and she needs to hire because or your lady employer is give birth as soon as possible, so that right now she's willing to hire for taking care of the baby, can you accept the
I will
job
accept
offer?
the job, ma'am.
And if they has also a kids, can you also taking care?
Yes, ma'am, I will take care of the kids. I will treat them as my own.
And at the same time, doing all the household chores.
Yes, ma'am.
Okay, how do you handle your homesickness?
I'll just keep busy to my work and to my duties.
Okay, your name is?
My name is Ruth Ann Barbado,
Your religion is what?
Roman Catholic.
Any day for your day off, it's okay with you.
It's okay, ma'am.
Can you also follow and respect for the grandparents of your employer if they are visiting or still living?
Yes, ma'am.
Okay, Miss Ruth Ann, thank you for your video presentation and good luck.